Welcome back to The Explainer. Today we're going to tackle a really complex topic that affects millions of people, ulcerative colitis. We're going to demystify it, break down what it really is, what's going on behind the scenes, and most importantly, how it's actually managed.
So let's just start with a really core question. What if your body's own defense system, your personal bodyguards, suddenly started attacking you? It's like a case of mistaken identity, right? This whole idea of friendly fire, well, that's pretty much at the heart of what's going on with ulcerative colitis.
All right, so let's dive into what this condition, often just called UC, is all about. What does this internal battle actually feel like for someone living with it?
Okay, so at its core, UC is a type of inflammatory bowel disease, or IBD. And the key words you really need to remember here are chronic, which means it's a lifelong thing, and continuous. It's this nonstop inflammation that happens only in the inner lining of the large intestine, your colon, and it creates these really painful sores, or ulcers.
Now, what's really interesting is that UC has a very specific signature. It follows a kind of playbook that helps doctors diagnose it. First, it's a relapsing remitting condition. That just means you have periods where it's really active, we call those flares, and periods where things are quiet, or in remission. Second, the inflammation always kicks off in the rectum and then spreads upwards from there in one continuous piece, no skipping around. And finally, it sticks to just that inner lining of the colon. These rules are super important.
So when you have all that inflammation, the colon just can't do its job of absorbing water properly. And because of those ulcers, the lining starts to bleed. The result? Well, it's the one symptom that usually sends people to the doctor. Frequent, often bloody diarrhea, and it comes with this intense, sudden, gotta go right now feeling of urgency.
You know those rules we just talked about? They're absolutely crucial for telling UC apart from its well-known cousin, Crohn's disease. See, Crohn's is kind of the wild card. It can pop up anywhere from your mouth to your anus, it creates these patchy skip lesions, and it can burrow deep through the entire wall of the intestine. But UC? Nope. It sticks to the colon, it's continuous, and it only affects that inner lining. It's a big, big difference.
But here's something that might surprise you. This isn't just a gut problem. For about 30% of people with UC, the inflammation actually shows up in other parts of the body, far from the colon.
Yeah, they have a fancy name for it. Extraintestinal manifestations. Basically, it's the body's overall inflammation spilling out. So you might see things like painful joints that feel like arthritis, painful skin nodules, eye inflammation, and even some really serious liver problems. It's a powerful reminder that what happens in the gut doesn't always stay in the gut.
Okay, so with all these different symptoms floating around, how on earth do doctors pin this down? It's like a detective story, really. Let's look at how they conduct the investigation.
Right, so getting a diagnosis isn't a one-and-done thing. It's a careful process. They'll start with lab work, blood and stool tests to look for markers of inflammation and, just as importantly, to rule out any infections. But the real game changer, the gold standard, is a colonoscopy. This is where they can actually go in with a camera, see that continuous inflammation with their own eyes, and take tiny tissue samples, biopsies, to look at under a microscope. That's what really seals the deal.
Which, of course, brings us to the million-dollar question, right? Why? Why does the body's immune system get so confused and launch this attack on itself in the first place? Well, the leading idea right now is that the immune system isn't necessarily broken, it's just overzealous. Think of it like a security system that's way too sensitive. It sees the normal, friendly bacteria that live in our gut, stuff that's supposed to be there, and mistakes them for dangerous intruders. And the lining of your gut? It just becomes the battlefield, the collateral damage in this constant fight. And it's not just one thing that causes this. Scientists think it's more like a perfect storm of three key ingredients. You've got your genetics, a certain predisposition, you've got that haywire immune response we just talked about, and then you need some kind of environmental trigger to light the fuse. That could be an infection or even just an imbalance in your gut bacteria. All three have to come together.
Okay, so you've got the diagnosis. Now what? What's the strategy? Well, it's really a two-part mission. First, you've got to put out the fire. That's the active flare. We call that inducing remission. Then, once the fire is out, you have to do everything you can to prevent new ones from starting. And that's called maintaining remission.
To do that, doctors often use what's called a step-up approach, kind of like climbing a pyramid. You start at the bottom, the base, with milder medications called 5-ASAs for less severe cases. If that's not cutting it, you step up to corticosteroids to knock down a flare. The next step up is immunomodulators for long-term prevention. And then at the very top, for the toughest cases, you have these incredibly targeted drugs called biologics and small molecules.
And I love this analogy because it really spells out what these different drugs do. Think of corticosteroids as the firefighters. They're the emergency crew you call to put out a huge, raging fire, fast. Then you have the immunomodulators. They're like the fire inspectors, on-site long-term, making sure the building is up to code and preventing new fires from starting. And the biologics? They're the super high-tech smart sprinkler system that can detect a tiny bit of heat in one specific spot and put it out before it ever becomes a real problem.
So, that all sounds pretty good. But what if it's not enough? I mean, for some people, even these powerful medications just don't do the trick, or other serious problems pop up. What then?
Well, this is where we see another massive difference between UC and Crohn's. Remember how UC is only in the colon? Because of that, if you surgically remove the colon and rectum, you remove the disease. It's a cure. Now, this surgery, a total proctocolectomy, is obviously a huge deal, a major life decision. But it's an option that can completely eliminate the inflammation for good. And sometimes surgery isn't just an option, it's an emergency. There's this rare but incredibly dangerous complication called toxic megacolon. This is where the inflammation gets so bad that it basically paralyzes the colon muscles. It can't move anything along, so it swells up like a balloon, getting wider than 6 centimeters. And at that point, there's a very real risk it could burst, which is a life-threatening situation.
All right, so let's put all these pieces together and look at the big picture. What's the outlook? What's it really like long-term to live with a chronic illness like this?
Well, one of the toughest parts is the unpredictability. This chart really drives it home. If you take a group of people who are in remission, feeling good, in the next year, about half of them will stay that way, but the other half will have another flare. So you're constantly navigating this cycle of feeling well and then not. It's a real journey.
So what are the key takeaways for the long haul? First, and this is the most important thing, people with UC generally have a normal life expectancy. That's fantastic news. But it does require lifelong management. We know that somewhere between 10 and 30% of people might need that surgery at some point in their lives. And because of that constant inflammation, after about 8 to 10 years, regular cancer screenings become absolutely critical.
And I think this really sums it up perfectly. It's a lifelong condition, for sure, but it is not a life sentence. The whole goal of modern medicine for UC is management. It's about giving people the tools, the knowledge, and the treatments they need to live a full life, to be in control of the disease instead of the other way around.
So let's end on a question looking to the future. We've talked a lot about the immune system, but we also know the gut microbiome, that whole universe of bacteria inside us, is a huge piece of this puzzle. So, what if the future of treating conditions like this isn't just about calming down the immune system? What if it's about actively restoring balance to that inner world? I mean, that's a really exciting thought, and it's a frontier that science is exploring right now.